Now we know there's physical changes in the brain due to neuroplasticity, meaning the brain can change and fluctuate depending on simple things like our beliefs, our thought
Hmm.
process, right? Our
Yeah.
experience of pain, all the different
Hmm.
experiences. So absolutely, you can put in quotations, rewire the brain. It's just a matter of you can also wire it to be more sensitive to pain just as much as you can wire it to be less sensitive to pain, right? So that's what's happening as we're getting more in that protective mode and that pain hypersensitivity increases. We're rewiring the brain to feel pain more. So we can undo that and rewire the brain to feel pain less.
It's great to have you on Untangle today. I I love and hate this topic. Talking about pain is just it's fascinating. So many different complicated angles. And I want to just start by understanding what inspired you to study pain and also to really challenge, I think, what is a conventional approach to solving pain or to pain management, if you will.
Absolutely. Well, first of all, I want to say thank you so much, Patricia, for having me on today. I really appreciate it. When I look back at what kind of started me on my journey, it was originally in pre-med, hurt my knee playing college basketball, and was exposed to the physical therapy, sports medicine way back when, and fell in love with that and the relationship that I was able to build with patients at the time. So very conventionally trained all the way through. Actually, if I remember a friend of mine was taking St. John's Wort or something, I'm like, oh my God, that could, herbs could kill you. I was just so had no idea about conventional. But then when I had an issue with my health, and conventional medicine wasn't able to help me, kind of coincided with I was seeing my patients who were doing well to a point, but they weren't like getting better like 100%. And they were doing what I thought and what, conventionally they should have been doing, but they still had pain. And then, so I was always curious, what else could we do to help these people? I moved more towards alternative and complementary to help myself, my own health issues. And then I have a clinic now called New Health and Wellness in Wauwatosa, Wisconsin, that focuses on helping people with pain. But I've also married the holistic approach. I went back to school, become a nurse, and hopefully we'll find some time to complete my clinical so I can finish my nurse practitioner certificate. But I'm so busy with the clinic because so many people are looking for alternatives. Now,
Yeah.
conventional medicine does help people with pain, but for some, it's people don't want the route that conventional medicine takes, or it's not helping them, again, get it over that hump. So that's
Mhm.
where, again, another personal experience for me. I was dancing at a wedding with my son, doing the polka, and my knee just popped and blew up like a balloon. And being a physical therapist, I wanted to know what that was. So I went to the doctor, thought I'd have a great discussion with a colleague, and they just said, put my x-rays up and basically says you're full of arthritis and you need a knee replacement or you can have a cortisone injection. And I was like, whoa, wait a minute.
That's a pretty big difference.
Exactly. But I was grateful for that experience because I saw that my knee did have a significant amount of arthritis, but I had not had pain up until that point. So with menopausal changes around that same time made me more susceptible to having an injury because of that arthritis that I didn't know was there. And then, so that was a good thing that came out of that. And the other thing that came out of that after the discussion was I was angry, to be honest. I was impassioned because I thought, how many other people are getting this information? And as a first line, and they trust their physician, obviously, but there's so much more that can be done on a holistic basis that even if they then eventually did need surgery, they would do so much better after surgery if they address these things first.
So, what did you end up doing for your knee at that time?
So I ended up going back to my clinic and treated my knee with my soft wave technology, which is a shockwave device, a true shockwave device. There's a bunch of different types out there.
Hmm.
And I was able to, I had this is crazy from just the polka, but I had sprained my ligament in my knee. My meniscus had already been pretty much worn away because of the arthritis over the years. And I was walking on crutches right after the wedding, or using crutches right after the wedding. And I was able to get rid of those in 3 treatments, so 3 weeks. Normally in my profession, I've been doing this for 35 years, that would take a good, 2.5, 3 months to kind of get back to a normal gait pattern. But softwave technology allows me to accelerate the healing process for patients.
Hmm.
And then along with the exercise knowledge that I have and the manual therapy skills that I have, my team and I were able to help me move forward and do really well in it. To this day, I haven't needed surgery because it doesn't hurt. So I just keep my strengthening up. I can do all the things that I love.
Hmm.
And, maybe if I need surgery someday, I'm just going to be stronger and will do better with it if I do need it. But at this point, I have no desire
Right.
to have it.
Well, how do we get to the root cause of the problem? Because sometimes you need surgery.
Yes.
I had the same thing where I had a full thickness tear in my supraspinatus in my rotator cuff. And the surgeons all said you have to have surgery. And then I spoke to some non surgical folks in physical therapy, and they're like, we can work with this. I have full mobility and never had surgery. And that is a really difficult surgery, and also one that isn't even 100%,
Oh,
doesn't
I see.
even necessarily last for a long time. But it was really confusing because surgeons are trained to do surgery. And so what they're looking at is, I can fix that, but not everything needs to be, quote unquote, fixed. So it's interesting to me. So how does one get to a root cause of what's really going on and then make a decision, which is in the best short-term and long-term interest
Yep,
for them?
absolutely. Great, great questions. I think everybody thinks about after
Yeah.
having a situation like yours or mine, right?
Yeah. Yeah.
So because I come from a physical therapy background, what I look for when there's a musculoskeletal injury like your supraspinatus part of the rotator cuff or my issue with my knee is, okay, is there something that I can do to take the stress off of that area to help it heal? So if I can take the stress, so for example, if I kept
Yeah.
scratching my hand, it would get red and puffy, right? But if I
Hmm.
kept scratching it, didn't leave it alone, it would still stay red and puffy and irritated. So the scratch is the trigger. So we remove the trigger, and then the body amazingly in 2 or 3 days, it's not red and puffy anymore. In 2 or 3 weeks, I don't even see that my hand had a scratch. That's the body's normal, natural healing process, right? So we want to give our body time to heal, but we also want to give it time to heal and kind of instruct it how to move to take that pressure off, right? To get rid of that trigger. And that's
Hmm. Hmm.
called biomechanical analysis. And all of my patients that come in to see myself or the other therapists here we'll take a look at their biomechanics. How are they moving? So if we can take the stress off of that area, and that will decrease the inflammation, and then strengthen around that area, and maybe potentially some people need some flexibility, but also stabilize that area. And what happens with some people is that if you had an injury and it wasn't necessarily acute, like you didn't fall and hurt it, but over time you compensate. Your movement compensates for that injury, right? So we look for those
Hmm.
compensation patterns to try to correct them. So that's what should happen in physical therapy these days. Some of the physical therapy places are kind of like mills where they're just seeing, three patients in an hour and just getting exercises. And we've lost some of the hands-on work and the biomechanics analysis. But a good physical therapist should look at your biomechanics and how you're moving, see if they can help you move more efficiently. So that's number one. And that's probably 70 to 80% of my patients do really well with that. And then utilizing soft wave to bring down that inflammation, and then doing functional exercises to kind of get them moving and get rid of those compensation patterns and get them moving more efficiently. So that's the vast majority. But then if after 2 or 3 treatments or four, maybe four at the most, my patients aren't 50 to 100% better, I'm starting to look for different causes. And two other or three significant causes, really, two are very related. One is hormones. So as our hormones change, what patients don't realize and people in general don't realize is when our hormones are in our sweet spot, our Goldilocks level, I like to call them, for women, estrogen and progesterone in particular, they're actually anti-inflammatory molecules in our body. So they help us control inflammation. But then as we go through perimenopause and menopause and we lose those hormones, we lose that protection. So things that we've been doing all our lives, maybe not eating the greatest, or maybe doing some stuff, taking medications or this different types of things, those have been protective. Our hormones allow us to be protective against that. We lose that protection and we keep doing the same habits, still have the same behaviors. So then that inflammation can start to bubble up, and women in menopause, perimenopause, experience joint pain and muscle pain just as often as hot flashes. And nobody really talks about that, right? Everybody talks about hot flashes, but you don't hear a lot about muscle and joint pain in menopause. One of the things we then suggest is looking at your hormones, see if you want to address those naturally or with hormone replacement. But even prior to that, because the gut is really important in helping to regulate our hormones and also regulate inflammation, some patients I work with on improving their gut health and looking for potential food sensitivities, which I personally experience food sensitivities that cause my joints to ache and my back to hurt with pain down my leg. I have a couple bulging discs in my back. but I don't, and that's what I always attributed the symptoms to. But when I stopped eating the things that I found out I was sensitive to, I no longer have the pain in my back and down my leg, even though I still have the bulging disc, not herniated.
Well, how did you know what foods to eliminate? Like, so what you're saying is that there are all these interconnections. And
Absolutely.
most of the physical therapists, because I go to physical therapy too, they're not looking at all of these different interconnections. They're working on the exercises to give you more mobility and to heal your pain. But that's really what they're doing.
My goal to change that, but yeah,
Yeah.
that's exactly what
Yeah.
I'm doing.
So, yeah, how does that happen?
Yep. So some people, when they come to our clinic, they can have that holistic approach. But when they go to other clinics, they might need to find an additional person, right? The person that they're working with physical therapy and the biomechanics aspects, addressing compensation. But then if they're not getting better, hopefully that physical therapist sees that they're not improving the way that they should, and then can refer them to a functional medicine expert like myself, or a nurse practitioner, or a naturopath, or even a physician that may have a specialty in functional medicine. Now they're all going to have different approaches, just like anybody else. So sometimes, like anything, we need to find different people that we connect with and that
Mhm.
resonate with, right? Because I wish I could say everybody should be treated by X, Y, and Z, but everybody's so different and everybody has a bit of a different approach. So you need to find that
Yeah.
person that you trust and that you're confident with
Yeah.
to help you through that. But I think the thing that those people miss is the gut aspect of it, right? So you can take hormones to the cows come home and get your levels balanced, but if you don't address those underlying issues that are still contributing to inflammation, like gut health and food sensitivities, through some reliable testing, because there's some testing
Mhm.
out there now that has been shown not to be as reliable. If you don't address those things and we all know now, or pretty much anybody who's like into holistic, we all know about the anti-inflammatory diet, or at least we've heard about it, heard about the Mediterranean diet. So we need to start changing and moving towards that, especially as we age, to give ourselves more nutrition, right,
Mhm.
and less inflammatory foods.
So you're basically saying as we age, we need to be more mindful about our overall health and wellness for every part of us, and that will have an impact on pain. And
Exactly.
when you talk about compensation patterns, are you saying, like, for example, when your knee pop, you might lean more on the left side and that might hurt your hip. And if somebody doesn't notice that, or for me, I might hold my shoulder in a different way. And so my neck will be more tense and I might have more pain in my neck or my cervical spine because of that. And you're saying your physical therapist hopefully will be able to look at your whole body and give you exercises that will kind of counter where you're compensating.
Yep, and also do
Yeah.
manual therapy to help with that as well too. And if they have something like soft wave
Yeah.
technology, they can utilize that to help with inflammation. So you're
Yeah.
absolutely right. When I hurt my knee, what happened to me about 6 months after that is I started to get plantar fasciitis symptoms. And I'm a physical therapist. I should have known to work on preventing that. And then, of
Yeah.
course, I had little bits and pieces of, oh, is that, well, my heel hurts. Oh, I'm just going to ignore it. So I just kind of became like what my patients typically do. I'm going to ignore it until it throws a brick against my brain, and then I have to pay attention. So then
Right.
I had
Right.
to do strengthening of my hip, even for the plantar fasciitis. I had to do flexibility exercises. I had to do
Yeah.
all those things to get my alignment better. And when I did a survey of 100 women who have had plantar fasciitis, 60% of them, 60% of them, had a previous injury within a year or two. The compensation patterns potentially affected them and caused the plantar fasciitis.
Wow. And how long does it take for something like that to go away? Because then once you have plantar fasciitis on one foot, then you lean more on your other foot and then your hip. And it seems like it's such a cycle.
Yeah, it's kind of like a whack-a-mole, right? So something
Right.
happens
Right.
and something else pops up. So as soon as you feel those symptoms, or if the symptoms start to, escalate and the body's not able to
Yeah.
repair itself, then you need to go see someone. What we typically do is we go somewhere, they inject with cortisone, or they say take ibuprofen, or it's not an active treatment to address the root cause, the biomechanical issue. So
Yeah.
the earliest that's taken care of, the better for the patients to get better faster, so they don't start that compensation pattern or don't continue it to the degree that it creates another problem. So early
Mm.
intervention is really important for that. Go ahead.
Well, I was just going to say, I mean, some people have biomechanical um, what would you abnormalities, like you might have a bunion on your foot or you might have hip dysplasia. Like those are things that you may have been compensating for your whole life. What does one do in those kinds of situations, regardless of like also some knee mechanical things that are just, genetic that you've had for your whole life? How does one identify those problems and the problems that they cause?
So the body is so amazing that sometimes I see people walking down the street and they seem to be pain-free, but they have so many biomechanical issues that I want to give them my card and say, hey, you're going to need me at some point,
Right, right,
but they
right.
don't have any pain because their body has compensated in such a way and their
Mm.
inflammation, maybe their hormones are nice and balanced, maybe their gut health is pretty good.
Uh-huh.
They're not dealing with that issues from the compensation. But if that same person is in a car accident or that same person hurts themselves playing pickleball, that's when they'll start to see those patterns that they've had over the years really impact that. So we're not going to change somebody's complete, like a genetic issue, but we can help that person compensate in a positive way to take pressure off of that area. So if somebody has really advanced knee arthritis, for example, and their knee is kind of turning in, your knee is made of two different joints, the femur and the tibia. And sometimes over time, what can happen is one side will wear away. So the meniscus will wear away, and they'll say that you have bone on bone. But what you can do is, I'm not going to magically get rid of arthritis. Like I've not magically gotten rid of arthritis in my knee, but I don't have pain. So I don't really care how much arthritis is in my knee because I don't have pain. So one thing we can do from a physical therapy, a biomechanical perspective, is actually get some custom fit orthotics to offload the stress on the inside part of that knee to open that joint line just a little bit so that there's less pressure on there.
Mm.
And an experienced physical therapist can look at the body and say, okay, here's how we can help you to compensate in a positive way
Mhm.
for that issue that you may have had all your life and now after an injury is really, or during menopause, or when the hormone changes, is really starting to rear its ugly head now. So there are definitely things that you can do to offset those things. Like I wear
Okay.
orthotics in my shoes every day.
Yeah,
I've done that for
me
25
too.
because of back pain, and I had those adjusted after my knee incident, so that's then helped my knee and the plantar fasciitis issue. So it's all together though. Orthotics alone would probably have not done it, but with the exercise, the orthotics,
Mhm.
and
Yeah.
watching my movement patterns, and also anti-inflammatory eating plan, I can keep that inflammation down. Supplementation to help decrease inflammation as well too is really helpful to me.
I'm going to ask you this later, but do you have on your website or anywhere like a series of exercises that people can do for these different types of situations?
So I have for specifically for plantar fasciitis, I'm just launching our online plantar fasciitis program. It's a foot pain relief program where all the exercises are there for
Mhm.
patients to be able to purchase and then go through those and have support and have them understand how all these changes in their life and their hormones, things like that, are contributing. And then my goal is to have a program like that over time. The difficulty with that is everybody's a little bit different, right? So they really should be in a supervised exercise program so that they're not making the problem worse, right? We
Mhm.
certainly don't want that to happen.
Yeah.
And that's what I talk about in that program. Here are the things that I do. 90% of the things that I do with my patients who have plantar fasciitis, but that 10% might tweak it for you particularly, right? So
Mhm.
if the program isn't going well, then they can come in or see me online to kind of tweak some of the things that they specifically need to do for their situation.
That's great. I'm so glad you have that. So let's talk a little bit about the science of pain, because we're talking a little bit about biomechanics, and some people feel pain differently than other people, as you've been mentioning. Can you take us through how pain works neurologically? What's happening in this like multifactorial thing that is impacting almost every part of our body?
Yep. So I'll start with the very simplified explanation, then it gets more complicated the more we delve deeper into it. But generally, pain has gotten a bad rap. We always look at pain as, oh my God, I have to cover it up as soon as possible, right? And we've been conditioned to believe we should do that. But pain is a message, right? We need
Hmm.
to feel pain so that we stay protected, right? So what we want to do is if we're starting to experience a little bit of pain, we want to think, okay, what could this be coming from? Try to analyze it. Is it something that I ate? Do I always have pain after dinner? That type of thing. Or is it always when I wear certain shoes? but really looking at that pain as a message trying to tell us something. And
Mm-hmm.
society, and it's hard because there's a couple different stories I can share with you. One is my son, who's 21 years old. He had an ACL repair. I was there visiting him in the hospital, and they gave him all these medications that he could take afterwards. And they said, stay ahead of the pain, stay ahead of the pain, wake up, take this every 6 hours. And I was like, whoa, wait a minute. His body needs to heal. He needs rest. He needs sleep. Why would he wake up in the middle of the night to take it? Well, you want to stay ahead of the pain because you don't want to feel the pain. You don't want to, once this nerve block wears off, it's going to be extremely. And I'm like, okay, I get that, but let's step back here a minute, and we've got to find ways for him to heal. And now I heard that from a friend of mine who had knee surgery. Their doctor told him, stay ahead of the pain, stay ahead of the pain, get rid of it, da da da. But instead, we should be saying, okay, let's listen to our body. Okay, and yep, you can
Mm-hmm.
do things to modulate the pain, right? Especially if it's excruciating. But then in the long term, if we continue taking those types of medication, it's been shown to actually increase our risk of developing chronic pain and increase our pain sensitivity, which means that when those drugs wear off, we have more pain than before we started
Mm-hmm.
taking them. And that's how, especially with opioids, as we know, that's a very
Yep.
specific
Yep.
effect. But even NSAIDs, even over-the-counter NSAIDs, non-steroidal
Like
anti-inflammatories.
Advil. Yeah.
So taking those long term can actually impede our kidneys. Tylenol, if taken too much, can affect our liver. But also, we need to think about longer term taking them just in regards to pain sensitivity and increasing the reliance upon them, which is
Mm.
great for our gut health. I'm not against those medications. I think they have a use, but I think we're
Mm-hmm.
overusing them and we're not educating people, because most people, when they find this out, they're like, oh, I didn't know that, right? So I'm going to try to minimize the use of that.
Well, I think it also has so much to do with the level of the pain. We talk about acute pain and chronic pain, and you can certainly understand if someone is in very deep pain over a long period of time, you get a kind of desperate feeling and would do anything to relieve that pain because pain is so interferes with almost everything in your life. What does one do? I've studied like mindfulness and we've done lots of research on pain and courses on pain. And still, when I get into an acute pain situation, meditation doesn't work for me. It's just a lot more complicated when you're in that moment. And so I feel like people need more tools. You've talked about the soft wave technology. We'll talk about that a little bit more later, but what how do we hear the message and not feel angry? And when you feel angry and fearful, that intensifies the pain.
Absolutely.
So you need to intercept that
Mhm.
secondary
Mhm.
pain. What is your suggestion for that?
Prevention is big, right? So we need to, again, listen to our bodies, start to look at
Mm-hmm,
the
mm-hmm,
patterns. What is the pain doesn't just magically appear, right? There's
mm-hmm,
always a lead into it. There's always a trigger. So it's really trying to figure out what that trigger is. If it's not the way you're moving, if it's not biomechanics, if it's not your mattress, if it's not those types of what I call tangible triggers, which can be obviously looked at, then we look
mm-hmm,
at hormone levels. We look at what's the pattern. Are you, every time after you have lunch or every time after you have gluten, does your knee ache? Every time you have dairy, do you all of a sudden get, pain in your shoulders? What are the triggers that we could potentially address to prevent that? Now we have to be
mm-hmm.
willing to get rid of the triggers, because I'll tell you, we
Yeah,
identify triggers for some people and they look across the table and go, I'm not giving up coffee, or I'm not giving up beer, or I'm not.
right.
And then I go, but you told me you would do anything that you need to do to get rid of the pain. And then so there's a disconnect in how food and things that we're eating, even things that are good for us sometimes, can impact our body. I'll give you an
Mm-hmm,
example. I was driving to work, and I was probably in my 40s at the time, driving to work, and my hands were aching like crazy in the morning. And I didn't know why. I had x-rays, no arthritis, everything was good with them. There was no structural issue, no biomechanical issue. And so I had at the time had a patient who was really educating me about food sensitivities. She had celiac disease, which is a food intolerance, not a
mm-hmm,
sensitivity. But she also found that she had aches and pains that went away when she got rid of gluten, and then other foods that she was reacting to. And what I found was interesting, I did a food sensitivity test that she told me about called the ALCAT, and I found that I was reacting severely to spinach. And guess what kind of smoothie I was having every morning to try to be healthy, right? Spinach smoothie. Got rid of the spinach, then all of a sudden the pain went away.
Oh, it's so interesting. I interviewed, do you know Dr. Stephen Gundry? Yeah, he was on our show several weeks ago, and he brought up the spinach thing, and it saddened me because I love spinach. But what's interesting is not everybody's, like, to your point, sensitive to the same thing.
Exactly.
So you figured that out. That was lucky, since you probably assumed it was really good for you, which most of us do. But that's very sad. And also peanut butter,
Yeah.
not good.
Well, here's the thing that I think is everybody is so different. I don't think everybody should get rid of spinach. Like now I can have spinach. I'd have spinach
Mhm.
salads, but I don't use as much as I used to use in those spinach smoothies. Some of the sensitivities that I've had in the past, I've been able to still have in my diet, but I just don't have
Mhm.
them as often. And the only thing that I can't have, and I don't have celiac disease, but it just doesn't agree with me, is gluten. That's me personally.
Mhm.
But I don't believe everybody has to get rid of gluten. So I think sometimes we give recommendations that these things are bad across the board, but they're not
Right.
necessarily. Or this
Yeah.
is
Yeah.
great for you across the board. And
Yeah.
maybe it's blueberries that you're reacting to. I've had patients who've reacted to blueberries, and that's supposed to be great for everybody.
Yeah.
So it's
True.
really important to find a person who's got good research-based testing that you can utilize, and then work on the health of the gut so you can add some of those things back in. We don't always just want to keep
Right.
taking things out.
Yeah.
I see patients like that who are like, I don't know what else to eat. I don't react to these
Yeah.
three things, but anything else I add to my diet, I react to. So what can I do? So we want to expand what they're eating to
Yeah.
make their gut more diverse.
So is this a gut or a brain problem? So when we talk about how pain works, it's in your brain, but you're saying, your gut is impacting that as well, that with through the gut brain axis.
Correct. So
Is that
so
okay?
there's the gut has an axis with pretty much every part of our body. So we experience the sensation of pain is truly in the brain, right? Even though we feel it in our knee or feel it someplace else. We know that through phantom limb pain, right? Where somebody
Mm-hmm. Mm-hmm.
found their leg has been amputated, their leg is not there anymore, but they feel pain where their leg was. That clearly isn't happening in the limb that's no longer there. That's happening in the brain. So all
Mm-hmm.
pain, if you listen to Lorimer Mosley from University of Adelaide in Australia, he talks about the science behind that. So
Mm-hmm.
I don't think we can ever separate out, is it gut only? Is it brain only? Is it joint only? I think that's what we typically do in conventional medicine. We try to compartmentalize. It's this one thing or it's one. I think some of those things will have more of an impact, but they're always working. So your brain will change when you have chronic pain. So if you continue to experience chronic pain, you'll eventually usually experience something called central sensitization, where your body becomes more hypersensitive to pain because it's trying to protect you, right?
Mm.
And those medications that I talk about enhance that effect, right?
Mm.
So back to your original question is what do we do if you're experiencing pain? So if you are able to figure out your triggers and remove those triggers, replace them with something else, whether it's a movement pattern or whether it's a different type of food or whether it's optimizing your hormone levels,
Mm.
then you can minimize the amount of pain that you're having, minimize the amount of intervention that you're needing, and then
Mm-hmm.
gradually your body can recover so that you have less pain over time.
So movement, food, and hormones. So let's say, so you break a bone, you're going to hurt because a broken bone
Yes,
hurts.
absolutely.
So,
My
okay.
friend broke her humerus, her arm bone in 8 places. I wasn't gonna give her any herbs for that.
Right.
I mean,
Right.
she needs surgery. She had, pins and screws in her. She needed that. Her arm wasn't even attached to her body anymore at that point. So those types of things, absolutely. That acute pain we can address with things like ice, we can address with, right? But instead of
Yeah.
taking something right away, actually, if you take those medications very soon, you're actually slowing down the healing process. So it takes you longer to heal. So if you can do
Yeah.
simple things like ice, rest, compression, elevation, all
Right.
the basic things that we know previously, that's a good way to address
Yeah.
acute pain.
Yeah. And so you're talking about over time to minimize pain that is not like the immediate broken bone or the immediate, whatever it is,
Mhm.
concussion. We talk about movement and food and how it impacts inflammation. And the more that the more that you try to fix those things with medications, the more you're maybe, continuing the pain versus prolonging. Thank you. Yes, prolonging the pain. So is that how you define in your book? You talk about the pain paradigm, the And how do you define the pain-free formula? Is that what we're talking about here? These different components?
That's what I
Okay.
put together in the pain-free formula. And we talk about the changes in your brain as well too. So it's kind of a whole,
Okay.
I separate them out in the book, but they're all
Yep.
really all related. So for example, let's take a person who is experiencing pain because maybe they're reacting to, let's say, spinach, so they find that out, they decrease that. So it's chronic pain. They've dealt with it for a long time. So they decrease the inflammation, the pain starts to decrease, the brain gets a message to go, okay, this movement isn't so bad anymore. So then the body is less protective of the movement because before that, we're afraid to move, right?
Right.
It gets
Right.
worse and we get into a vicious cycle, and we're afraid to move. So we don't move. So we get weaker and more stiff and more inflammation. And then this vicious cycle. So if we can get that inflammation down, find the trigger of what it is, get that inflammation down, then that sends that signal to the brain. And we don't want to blunt that through getting rid of the all pain all the time, because that's going to prolong it. Right.
Mm-hmm.
We want to
Mm-hmm.
listen to it and go, what are the triggers? What did I just do? What did I just eat? What did I just drink? Is it stress? Is it, do I get pain in my neck and shoulders because of stress all the time? Then your mindfulness,
Mm-hmm.
every person is very different in trying to identify those triggers.
Mm-hmm.
And it's no longer a vicious cycle. It's a very healthy cycle of kind of removing yourself from pain.
Yeah. Do you find that posture is a big component of pain, certainly like in the spine and the shoulders and the neck? And
Absolutely. So especially after an injury. So, if you look at most people around the world now that have iPhones, they're all bent over. They're using their computer, they're bent over. So
yeah.
most people, I would say 90% of us, if not more, have a rounded shoulder posture. So things get tight in the front, weak in the back. So we're not stabilizing. Now, over time, or I should say in the beginning, that we might be able to compensate for that, right? But then we go out and we play pickleball, and we've never done that before. And now our shoulders are forward. We're really tight here. Now we raise our arm up, and now we're squishing the tendons because we don't have the biomechanics that are efficient in our shoulders because of all that tightness in the front and weakness in the back. Now our biomechanics in the shoulder have changed. And now we're raising our arm up in a position that we typically don't do. And then we create bone spurs, we create tendinopathies, we create all this type of thing. And what we need to do is get our posture in the right place so that our ears are above our shoulders or above our hips, as close as we can, so that those movements, if we want to do them in pickleball, or if we reach for something, that's falling off of a table, that we have that motion and we have that movement to be able to compensate in a good way for those new movements.
Right.
1000% posture is extremely important.
I feel like your next book should be pain-free for pickleball. Because it's so popular, and then I'm sure you're bringing it up because there are so many injuries that people have as a result of it, and you're saying there are ways to avoid it.
100%. Yeah. And it's so funny you mentioned that, because I was just talking to a colleague and we were both like, we need to do an online program for that, like pain prevention and addressing pain for pickleball players, for sure.
Yes, for sure. That is, I could bring in a big audience for that.
All right, let's do that. I'll let you know when it's done.
Okay, perfect. You talked a little bit about the soft wave therapy. And as I said, I go to a physical therapist for my shoulder, and I had a broken wrist. I went for my hand and my wrist, and no one has ever mentioned soft wave. I've never heard of it short of your book. So what is that magic that's missing from all these other places?
Yeah. So soft wave therapy is a type of shockwave therapy. So shockwave has been around now since the 50s or 60s or even earlier. And that used to be used as a very high intensity for kidney stones, to break up kidney stones so you wouldn't have to have surgery.
Okay.
It's very high intensity. You need to be under anesthetic. You can't, do that. Then while they were treating the patients for kidney stones, they noticed that the vertebrae were starting to get more dense. And they thought, wonder if this could help with bone and fractures that weren't healing. Sure enough, they started using shockwave on that, and the bones started healing. Then they thought, well, this is what could it do to tendons? But they couldn't do it at that high intensity. So they brought it down to what's a low intensity. So soft wave is a type of low intensity shockwave therapy that can accelerate healing. I had never heard of it 5 years ago, never heard of it. A friend of mine brought it up to me, and she said, do you think this would work? She had a shoulder issue that she's a friend of 40 years that I was working with, and she had, I would say, 90% of her range of motion back. But whenever she'd sleep, in a weird position where her arm was behind her, she said she'd still have that pain. So of course, my first thing is, well, don't sleep that way. But she didn't like that answer. So she came across this soft wave therapy and said, do you think this will work? And I'm like, probably, I don't know. I mean, I haven't heard of it. I'm sure it's not gimmicky. I don't think it's going to really do anything. But then when I went she asked me to go with her to like a demonstration, a treatment, and I wanted her to be safe, and I wanted to, just, let her know that.
Explore it. Yeah.
Exactly. I didn't want her to spend all this money and, it be, snake oil. So during the treatment, she sat there. And remember, I told you that her arm would have to be in a certain position for her to feel that pain. Well, she sat during the treatment, and Softwave went over the area, and she had the pain, and her arms were at her side. And I thought, wait, that's weird. It went over a tissue that's normal, and she didn't feel anything except for this little tapping. But then it went over the area that I knew was inflamed. So she started to go, oh yeah, that's the spot. That's the pain. And I thought, that's very interesting. So I started to kind of lean in and listen. And then I dug into the research. It took me 8 or 9 months to kind of really figure out what the heck it was. And then there's several different devices. I like Softwave because it is the most comfortable thing for my patients when I compared them to the other devices. And it accelerated healing like it's something that I haven't seen. So she, at the end of that treatment, she raised her arm up and she goes, it's gone. And the pain was gone. And that was a one and done, I call it. And I think serendipitously, I was meant to be there because I wouldn't have believed it if I wasn't there sitting and watching it. Most of my patients aren't done in one treatment, but what would typically take me 12, 14, or 16 treatments in the past, and I'm pretty good, I think. I'm a physical therapist for 35 years. What typically would take me that long usually is about 3 to 6 treatments now. So it's accelerating the healing process significantly.
Yeah. Now, is it only, and I'm sorry, go ahead.
It's very new to the physical therapy market. So that's why most physical therapy places wouldn't have it. And it's at this time not covered by insurance. So you do have to pay out of pocket for it. So that's why now it's starting to emerge in more physical therapy. I help physical therapists implement it in their clinics. We use it for pelvic health, sexual health, musculoskeletal issues, so many things.
Can an individual buy it, or does it have to be like, are there, I don't know, lower end versions that you can have at home for pain?
An individual can purchase it if they only utilize it on themselves, but it is it's what's called a prescribed, it has to be from somebody who can prescribe it. So a physical therapist, a physician, a chiropractor, NP, PA, those types of people. In the lowest end version of a good true shockwave device is around $50,000. So there are some people who have that and can purchase it, but it's not something that the typical person can go out and afford to have that home.
Yeah. Well, it's fascinating. Is there anything else? Is there anything like the soft wave therapy that people are using for, like, similar to that, but not exactly that?
Yep. So there's other shockwave devices out there, and those kind of the energy comes out like a laser beam, like the old lithotripsy to break up kidney stones. But soft waves comes out like a flashlight. So if people would go to Softwave TRT, that's thomasrobertthomas.com, and then look for provider search, they can see what providers in their area that may have Softwave that they could get a treatment from. There are other shockwave devices that people utilize. I love Softwave because I've compared all the other ones to it.
Yep.
The patients react really well to it. But I think it's at least great to explore if someone in your area has it.
It seems like it would be great for any kind of, like, hospitals should have that because it would be so great for healing.
Absolutely.
Do you think that the brain, and again, maybe this is all part of what you're saying, can be rewired to
I know that you had Dr. Joe on, Dr. Joe Dispenza.
Right.
I follow him actually a lot.
Okay.
I'm going to one of his retreats in a couple weeks. I'm excited about that. I've never been, so it'll be really interesting. But yes, based on research, we now know that neuroplasticity in the brain, it used to be talked about to rewire your brain and everybody would be like, oh yeah, whatever, that's just kind of foo-foo. But now we know there's physical changes in the brain due to neuroplasticity, meaning the brain can change and fluctuate depending on simple things like our beliefs, our thought process, right? Our experience of pain, all the different experiences. So absolutely, you can, put in quotations, rewire the brain. It's just a matter of, you can also wire it to be more sensitive to pain just as much as you can wire it to be less sensitive to pain, right? So that's what's happening as we're getting more in that protective mode and that pain hypersensitivity increases. We're
Yep.
rewiring the brain to feel pain more, so we can undo that and rewire the brain to feel pain less.
And what are some kind of daily habits that people could employ that would be a really simple way to support that?
Yeah. So you mentioned one of them that's supported by research, mindfulness,
Yeah.
meditation, things like that. But here's a simple thing that I have my patients do. So if somebody is experiencing chronic pain, what I'll ask them to do is think of a time in their past when they never had pain. Just imagine them back when they never had pain before. If they have a very difficult time remembering that, I mean, they can consciously remember, but when they actually close their eyes and think about it, they still even feel the pain just sitting there and they're not even moving. Then what
Mm.
I say to people is, oh, well, let's go to the future. Now think about yourself picking up your grandchildren in the future or whatever it is that typically causes you pain. Can you think of yourself in the future without pain? And the vast majority of people with chronic pain really struggle with that, right? Really struggle with that. So what I would say from a simple daily thing is to really just reiterate that and go into the past and really go, okay, it's just thinking, meditating. If you're not into meditation or mindfulness, just sitting and going, okay, closing your eyes, thinking back in the past of a time when you know that you didn't have pain, and really try to remember that you didn't have pain. So you might have to do some breathing activities. You might have to do some, kind of conscious things to remind yourself. But I always tell my patients to use this phrase: in the past, I used to, whatever it is, and now I choose to, whatever it is. So in the past, I used to have pain when I picked up my grandkids. Now I choose to know that I can bend over and pick up my grandkids and I'll be able to do it pain free or with less pain. And then start to do that while you're visualizing, just continue repeating that. And that can start to
Mhm.
change the sensation that the patients are feeling just sitting in front of me.
Yeah. What are your patients, let me put it this way. How do your patients react to this kind of mix of physical, emotional, and spiritual healing? Or do they come to you because they know they're going to get the trifecta of healing?
So I'm in Milwaukee, Wisconsin.
Right.
Let me just set that preface first. Midwest town. I love
Yes, yes.
Milwaukee, but we're a little slower to respond to these types of concepts. So 10 years ago, nobody's talking about this in Milwaukee. Nobody at all is interested. They think it's crazy. You're nuts. Fast forward now, I've had my clinic open for 5 years. I started to talk about these things when patients are not getting better, right? They're not
Hmm.
getting better.
Yeah.
What else can you do? Instead of going back and going, this is crazy, they're leaning in, wanting to know more. Okay. The internet helps with this when it talks about inflammation, what you're eating, and as people educate themselves on it, or if they already have a more holistic view.
Hmm.
So now it's a little bit easier, but I would say the majority of my patients come to me just for utilizing soft wave or advanced physical therapy and movement pattern changes. And then what I do is I'm educating them along the way to say, okay, this works extremely well for 70 to 80% of my patients. But if after 2 or 3 visits, you're not 50 to 100% better, there are these other things that we need to look at: gut health, hormones, food
Yeah.
sensitivities, all
Yeah.
that type of stuff. And they're more open to it. I wouldn't say that everybody's loving it and all over it, but they're much more open to it. And that's why I decided to write the book, so that I can say, here's the program, this is what we're looking at, but I'm going to meet you where you are. So you might not be ready at this point to address your gut health or address your food sensitivity or address your hormones. That's okay. You know that I'm here, that if you really find that the pain is coming back and you're not getting rid of it, nothing else is working, let's give this a shot. There's research to support it. So
Hmm.
everybody's at a different place. I would guess that in California and New York, they're probably a little bit more open to it sooner than some of my wonderful patients here in Milwaukee. But
Yeah.
when I see people on telehealth, that they come to me usually for that purpose, because they've heard about what I've done with
Yeah.
food and gut and all that for that.
Do you have a nutritionist on staff, or you have studied nutrition so you understand
I've
the?
studied nutrition in such a way that I wouldn't call myself a nutritionist from a licensing point of view, but as far as minimizing inflammation, that's my specialty, right? So
Hmm.
minimize inflammation by food and education through food. I do have nutritionists that I refer out to if it's something that's going to take a lot more than what I can give.
Hmm.
And they also refer back to me. nutritionist will refer to me as well to work on the supplementation part of it, the hormone part of it as well. So it's a nice symbiotic relationship with nutritionists as well too.
What do you think needs to happen in our healthcare system? Do you feel like if you were president, surgeon general, how would you redesign our healthcare system to focus more on supporting people with chronic pain and helping people to see kind of the multitudes of different options for us
Boy,
when we're in these
how
conditions?
much time do you have?
In 30 seconds.
Exactly. A little bit of a loaded question. I think there are special interests. I think overall, a very big overarching. There are certain aspects of our society, certain businesses that are more geared towards making money than making us healthy. The more unhealthy we are, some of these people will, or businesses, excuse me, will make more money. So there is no
Right.
incentive for those types of businesses or categories to change that because they make money off of it. So
Right.
I think just basically to start looking at over in Europe and showing all the different chemicals that are banned over there that we allow here that they know can have health consequences. So basic things like that, looking around the world to see the places that have a better health than what we do in the US and start implementing those types of things. Really put a lot of money behind what the well-researched, diets such as the Mediterranean diet as one example. And to talk about and put more money into research on what is the best food sensitivity test? What can we see beyond just saying somebody is gluten intolerant? There's more that people are reacting to. And it's not really an allergy either. So we don't eat something, some people eat something, break out, that's more of an allergy. This is a food sensitivity that can be over time. So digging into more of that. And what I would love, Patricia, if people would actually, or researchers or government, whomever, would put more money into to actually studying the placebo effect. We look at the placebo effect as something like, oh, that's just a bad thing because, then if the placebo is better than the drugs, well, that's kind of a bad thing. Well, no, if the placebo is better than the drug,
It's great.
Why? Why is that? And how do we teach people how to use this placebo effect in order to get better?
Yeah.
So
Yeah.
those are just a few things that I would do if I could wave a magic wand.
Yeah, so true. I have a friend who lives in Holland and she used to live in the US and she had surgery on her ankle and it whatever it was, it came undone. And the doctors in Holland said they would never have done the surgery that they did here because it never lasts more than 5 years. And it was just like not the right thing to do. And it's exactly to your point. It was, surgery was not the answer for that.
Right.
And that was just, you have so many great suggestions for looking at alternatives. And it would just be lovely to see that out there in much bigger ways.
And we know this in the US. Even the Journal of the American Medical Association says 1/3 of all joint replacements are unnecessary. So,
my God,
conventional medicine knows that, but yet these special interests are pulling us in a direction that doesn't necessarily support our health, right? So that's where we have, we kind of are crusaders in trying to get the knowledge to people so people can make their own decision, right? And that's another reason why I wrote my book, The Pain-Free Formula, so people have the information and then they can make the choices for themselves.
I think it's very hard for people to know how far to fight to feel better, right? Some things will get better over time if you do these 10 things, or some people want immediate relief, which might mean surgery, which might not be the best long-term, but it's really hard for an individual to weigh out those different options and to make a decision.
It is.
Necessarily trust our healthcare providers to help us with that.
It even goes deeper than that in the general conditioning that is going on. I'll give you a quick story. I was flying back from Australia where I used to live and have a clinic. And I was sitting across, it was a 12-hour journey into LA, and we were all in a bus going from one terminal to the next. And there was a woman across from me. I think I noticed them because she also had like a 10-year-old son who was about my son's age at the time. And he had his head in his hands and he was saying that he had a headache. And, his mom, as soon as he said it loud enough, his mom rustled around her purse, pulled out a pill bottle and said, "Here, take this." And he's like, "No, I don't want it." And she said, "Here, take this." And no, I don't want it. And she grabbed his arm and she pulled him in so they'd look at her and she said, take this. And if your mom ever looked at you like that, you'd take it. So she
Yeah.
pulls out the water and gave him the pill. And I'm thinking to myself, just give him the water. Why give him that pill right away? The water's probably he's totally dehydrated from this long journey.
Yeah.
But
Yeah.
so we've been conditioned now, and your young kids
Take the
were
pill.
conditioned to stop that pain immediately, do the fastest thing to address it versus stepping back and
Mm,
going, like my parents would have said, go outside and play, or obviously you couldn't do that on the bus, but have some water, have a banana,
yeah.
eat something. Your blood sugar level might be low. So I think it's more than just in that doctor's office to make the decision of having the surgery. It's thinking about how we've been conditioned to want to get the fastest thing that may or may not be the most helpful.
Yeah. 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 Such a complex issue topic. Is there anything else you want to share with us before we close here? This has been so rich with great information.
Thank you so much. I guess I really just want to anybody who's out there who's dealing with pain, just to understand that it does not have to be a life sentence. To really be accountable and say and keep looking. Soft wave might be an answer for you. Finding somebody who does more functional medicine might be an answer for you, even with joint pain. Just keep looking and make sure that you feel good with the person that you are working with as well. Because once you find those triggers and remove them, you may not never have pain ever. And I don't want you to never have pain, because it again protects us, but I don't want pain to control your life. So you can control your life and be active and happy for as long as you want, as long as we can figure out what these triggers are and get rid of them.
Yeah. Thank you so much. Really appreciate you being here today.
Thank you for having me. I really appreciate you.
Yeah.